Hello, everyone. Our names are Cayla Tokunaga. And we're currently pharmacy residents at Hoag Memorial Presbyterian Hospital, located in Newport Beach, California. We're excited to have this opportunity to speak with you today about epilepsy medications. Here are objectives for our discussion. We'll be covering a brief background of the common medications for seizures and epilepsy, such as its mechanism of action, uses, and side effects. We will briefly talk about treatment options for different types of seizures. In addition, we will go over the definition of drug-resistant epilepsy and recommend when you should see an epileptologist. There are certain medications that can increase someone's likelihood of having seizures, such as medications used for infections, depression, bipolar or schizophrenia, tramadol for pain, or natural supplements. Therefore, it's very important to report all of your medications to your doctor or pharmacist, or if there's any changes to your medication. As we begin learning more about seizures, it's important to understand the approach to therapy and treatment goals. Most seizures usually last for less than 2 minutes and do not need medical intervention. However, if the seizure lasts longer than 2 minutes, it can lead to brain damage or death in very severe cases. Make sure that you keep track of the time from the beginning to the end of the seizure so you and your family know when it's appropriate to seek immediate medical attention. When the medical team makes a decision on your therapy, our goal is to stop your active seizures and to prevent another seizure from happening in the future. When seizures last more than 5 minutes or 2 or more seizures occur without recovery of consciousness, this is considered a medical emergency and referred to as Statusepilepticus. The treatment for Statusepilepticus requires intravenous or rectal medications in a class of drugs called benzodiazepines. The preferred benzodiazepine is called lorazepam or Ativan. Physicians can use anti-seizure medications such as an alternative option in the hospital. Other examples of benzodiazepines are clonazepam or Klonopin, clozapam or Onfi, and diazepam or Valium. Again, these are medications used when stopping an active seizure. They work by activating a neurotransmitter called GABA in your body that slows down the activity of nerve cells in the brain. Common side effects are sleepiness, dizziness, forgetfulness, and dependence. Long-term use and sudden stop of these medications can cause seizures and withdrawal symptoms. Some of these medications are not appropriate for pregnant patients, so please let your doctor or pharmacist know if you're pregnant or you plan to become pregnant. Patients diagnosed with epilepsy often require long-term maintenance therapy to prevent recurrent seizures. The diagnosis of the type of seizure is critical as it helps the neurologist or epileptologist determine which medication would be most appropriate to trial. Seizures are generally classified into 2 main categories, generalized and focal seizures, and further classified based on the presence or absence of motor features. Generalized seizures affect both sides of the brain. This includes absent seizures, formerly known as petit mal seizures, tonic-clonic seizures, formerly grand mal seizures, and myoclonic seizures. Focal seizures, also known as partial seizures, affect one area of the brain and are subcategorized based on the patient's level of awareness during the event. This includes simple partial seizures, complex partial seizures, and secondary generalized seizures. In the event that the seizure does not fit in any of these categories, this is classified as an unknown onset. As we finish discussing medications for emergency situations and the diagnosis, we will now discuss chronic seizure management. Seizure medications are also referred to as anti-epileptic drugs, or AEDs. Anti-epileptic drugs are the first choice of therapy to treat epilepsy. Statistics show that the initial 1 or 2 drugs can control about 70% of seizure cases. Anti-epileptic drugs should not be stopped suddenly because it can lead to seizures. Therefore, it is crucial to talk to your doctor or pharmacist prior to stopping your medication. This graph shows a timeline of all the anti-seizure medications that have been introduced since 1850. Overall, anti-seizure medications have been around for a very long time. Since the first medication called bromide was introduced in 1850, there have been many other anti-seizure medications that are available in the market, which include the first, second, and third generation anti-epileptic drugs. Older medications have more side effects and are less commonly used nowadays. There are many treatment options for seizures, so you and your doctor can have a conversation on which medication would work best for you, considering the type of seizure you have and the drug side effects. It is often that one drug might not work better than the other for different people, so it is possible to trial more than one medication. Listed here are examples of treatment options that would be appropriate based on patient's diagnosis. As mentioned before, anti-epileptic medications is used to prevent you from having seizures. Factors that might affect the medication choice include diagnosis or type of seizure, physicians or clinicians' preference and experience, or other medical conditions that you might have. Again, keep in mind that medication selection and dosing are unique to each patient. Your doctor will discuss with you all the risks and benefits from each medication, so a shared decision can be made. As you might recall from the previous slide, anti-seizure medication selection has grown exponentially throughout the years. Older anti-seizure medications include phenobarbital, semitone, and carbamazepine. Newer agents have certain benefits, including more convenient dosing, 1 or twice daily dosing for many of them, fewer drug-drug interactions, lower rates of side effects, and less monitoring of drug levels. In addition, the overall effectiveness of medications remain the same compared to the older anti-seizure medications. In order to understand how anti-seizure medications work, we'll provide a brief overview of what causes seizures. A seizure can occur when excitatory or activating neurons in the brain produce a sudden surge of electrical activity in the brain, which may be caused by receptor malfunction or imbalance of the neurotransmitters in the brain. A deficiency in GABA, an inhibitory neurotransmitter, or an excess of glutamate, an excitatory neurotransmitter, can lead to a seizure. Listed here are the different approaches to suppressing the abnormal electrical activity in the brain. This includes normalizing the neurotransmitters GABA and glutamate, blocking or altering the calcium channels, which slows or stops the transmission of electrical signal, and blocking sodium channels, which slows the neuron firing rate. This image shows receptors and channels targeted by the various anti-seizure medications. This process occurs in between all the neurons in your body. The mechanism of action determines the drug side effects, so your doctor will choose medications that have different mechanisms to avoid additive effects. Anti-epileptic drugs are known to depress electroactivity in the brain. Side effects that could occur include dizziness, confusion, sedation, and impaired coordination. These side effects can increase the risk of impairment, falls and injury, and should be monitored closely throughout your therapy, but especially during your dose adjustments, additions, or changes to therapy. Now I'll pass it on to my colleague, Cayla. Side effects for each anti-seizure medication can vary. The side effects that are common for many anti-epileptic drugs include bone loss due to vitamin D and calcium deficiency, increased fracture risk, and severe skin rashes. Supplemental calcium and vitamin D are often recommended during therapy. Each agent has a risk of slowing down the brain function, as we previously mentioned, and central nervous system depression, but some are more than others. Keep in mind that each person responds very differently to medication, so some side effects can be more prominent in others. When adjusting therapy, physicians avoid adding agents with the same mechanism to prevent additive side effects. And here are some common medications seen on this slide that we will expand upon during the rest of the presentation. Anti-seizure medication can also affect how your body metabolizes other drugs. It can either speed up as inducers or slow down as inhibitors the metabolism of other medications. This is why it's crucial to continue to have an updated medication list and let your doctor know if any changes are made to this list. This can help to prevent the risk of serious side effects, changes in drug levels, and as there are known drug combinations that should be avoided. The list of medications listed on this slide include anti-epileptic drugs that are known inducers and inhibitors. Lamotrigine, or brand name Lamictal, targets sodium channels. Patients taking this medication have reported nausea, difficulty sleeping, drowsiness, fatigue, impaired coordination, and dizziness. One of the rare side effects of this medication is the development of a severe rash, as pictured here on the screen. If a rash like this develops, you should contact your doctor immediately and seek medical attention. It's important to understand that this rash typically occurs within the first 2 to 8 weeks of starting the medication, but it can happen at any time. If the medication, or if you develop a rash like this, the medication is generally discontinued, and then an alternative anti-seizure medication will be started. The next medication we'll discuss is kepra, or levetiracetam, which is a very commonly used anti-seizure medication that patients start with, since there are very few significant or no significant drug interactions. The mechanism of this medication is unknown, but it is thought to be involved with the GABA receptors and calcium channels. Common side effects of this medication include dizziness, drowsiness, fatigue, but in general, most patients tolerate this medication fairly well. Another advantage of this medication is that it can be switched readily to an intravenous formulation if needed in the hospital setting. Next, we'll talk about topiramate, or topiramate, and zonisamide, which are two agents that share similar side effects. Some that you should be aware of include sedation, memory difficulty, weight loss, mood problems, changes in taste, reduced sweating, and kidney stones. In addition, it's important to limit sun exposure and stay very hydrated throughout the course of therapy, as your skin can become more sensitive to the medication. One thing that's unique about this medication is its sprinkle capsule formulation, which can be opened and the contents of the capsule sprinkled onto soft food. This can be helpful for children and anyone who has difficulty swallowing medication, as it offers a very convenient administration route. Valproic acid, or valproate, and valproex have many different brand names, as you can see on the slide. If you or your family are treated with this medication, there are some important considerations, especially for those who are of childbearing age. There is a risk associated for neural tube defects, which is a birth defect, as well as decreased IQ scores if taken during pregnancy. For those pregnant or planning to become pregnant, inform your doctor so a shared decision can be made about your seizure medication. Other side effects to be aware of include liver failure, nausea and vomiting, abdominal pain, dizziness and drowsiness, weight gain, and vitamin and mineral deficiencies, specifically vitamin D, calcium, selenium, and zinc. Supplements can be taken to prevent bone loss and hair loss that can be associated with these deficiencies. Of note, if you have an upset stomach after taking this medication, a delayed release formulation can help to alleviate those symptoms. So maybe a formulation change might be appropriate at that time. This medication is also conveniently available in many unique dosage forms, including an oral solution, so sprinkle capsules, and then delayed release formulations as well. So it's very convenient to administer for many patients. Other anti-seizure medications include carbamazepine or Tegretol, or oxcarbazepine, or trileptal. They are very similar in mechanism of action and target sodium channels. These medications are associated with many of the general side effects that we previously discussed. The patients of Asian descent are at increased risk of serious skin reactions due to genetic factors, and it is recommended that before starting the medication, each patient is genetically tested to identify those who would be at increased risk. Since this medication can also cause nausea after administration, you can try taking the medication with food, or if that does not help, the doctor can also change the medication to a long-acting formulation to help alleviate those symptoms. The next medication is glucosamide or vimpat, which is FDA approved for focal onset seizures. This medication is usually well tolerated by most patients, but some of the side effects reported included dizziness, headache, fatigue, nausea, and tremors. It is important to let your physician know or your doctor know if you have a history of heart disease, heart defects, or irregular heart rhythms, as this medication should be used with extreme caution in that patient population. Phenobarbital and primidone are some of the older agents that exist for treating epilepsy. So many side effects associated with these medications often limit its use, as newer medications with fewer side effects are often trialed first. Some side effects known to be associated include drowsiness, mental impairment, dizziness, physiological dependence and tolerance, depression, liver injury, and skin reaction. These medications cannot be abruptly discontinued or you can't stop taking it all of a sudden because of the tolerance and physiological dependence that can occur. If stopped abruptly, withdrawal symptoms can occur, which can increase your risk of a seizure. So discuss with your doctor if you plan to discontinue this medication, and they can help you slowly decrease the dose to limit this risk. Semitone or dilantin and fosphenytoin are also some of the older drugs introduced in the 1930s, but are still widely used and prescribed for focal and generalized seizures, for Statusepilepticus, and as a second-line agent for patients with mixed seizures, including myoclonic and tonic-clonic seizures. They have very similar mechanisms of actions and target sodium channels, but one of the unique side effects similar to that of oxcarbazepine and carbamazepine is skin reactions, which agents are at increased risk for. Other unique side effects include skin thickening, toughness of facial features, and liver injury. In addition, supplemental vitamin B12, folic acid, calcium, and vitamin D are generally recommended for most patients. Your doctor may also require you to check blood levels to determine what the drug level is in your body, and this can help to keep you safe and also optimize drug therapy. Semitone may also reduce the effectiveness of most forms of birth control. The use of an alternative non-hormonal contraceptive is recommended for all patients. We will now talk about our last agent, zurontin, which is effective for the treatment of absence or absent seizures and less effective against generalized tonic-clonic and focal seizures. This medication, like many others, is well tolerated by some patients, but some can experience some weight loss, abdominal pain, nausea, vomiting, hiccups, and skin rashes with its use. Now that concludes our review of the commonly used anti-seizure medication. We will now discuss drug-resistant epilepsy. By definition, drug-resistant epilepsy can occur when a patient has failed to become seizure-free with adequate trials of one or more seizure medication. Your doctor may ask you several questions to determine if you may or may not have drug-resistant epilepsy. These questions can include how are you taking the medication? How often do you forget to take the medication? Are you experiencing any side effects that are very bothersome? And they may ask you about any triggers or other lifestyle factors that may affect your seizure control. Noted here in the picture, about 48% of patients are seizure-free with their first drug. However, more than half of patients may require more than one medication to achieve seizure control. It is important to follow up with your doctor to determine if your seizure medication is appropriate, but it's very common that patients will require one or more trials of medications in addition to having multiple medications to achieve that seizure control. That is our ultimate goal. And lastly, we will discuss when you should see your epileptologist, who is a doctor that specializes in epilepsy. It is appropriate to continue to see a neurologist if you are seizure-free, tolerating your anti-epileptic medication without complications. But if you're having side effects from the medication and your neurologist does not know what to do with your medication or does not wish to make any changes, you can seek a second opinion from an epileptologist. If you've tried 2 or more medications and failed, if there is any question about your diagnosis, consider visiting an epileptologist. And lastly, we'll talk about women of childbearing age. It is crucial that this population of patients see an epileptologist since there are special considerations regarding pregnancy and epilepsy. For example, certain medications require drug levels. During pregnancy, drug level monitoring may be required to occur more often, and dose adjustments may be necessary to keep you seizure-free. In addition, there are some agents that pose potential risks during pregnancy. So you and your doctor can make a shared decision about how to optimize your seizure therapy during pregnancy. Here are some helpful websites from the American Epilepsy Society and Epilepsy Foundation that will help you to learn more about seizures and epilepsy. Thank you for taking the time to listen to this presentation, and I hope this lecture has given you a better understanding about epilepsy medication.
Well, that concludes our day 2 of the Epilepsy Awareness Day event, and thank you so much for participating and joining our presentation. If you have any questions, I'm available, or you can type in the chat box. Thank you.